Benzodiazepines have become indispensable in modern medicine due to its numerous possible applications. Due to their diverse properties such as anxiety relief, muscle relaxation, amnesia and hypnosis, benzodiazepines are used for numerous complaints. In the different disciplines of medicine, there are various indications for the use of the numerous active substances. For example, psychotic symptoms, fear of flying, epileptic seizures, restlessness and states of tension are possible areas of application. Benzodiazepines have been known for over 60 years. In 1962, the active ingredient diazepam, also known as Valium, was introduced to the market. This drug is used for anxiety disorders, short-term treatment of sleep disorders, seizures, alcohol withdrawal syndrome and sedation. Since the launch of Valium, approximately 40 other benzodiazepines have been added, which are used for adults and children, mainly before surgery. The number of tablets produced is approximately 400 billion daily doses, with an upward trend. The effect in the brain is based on the linkage of the active ingredient to the GABA receptor in the synaptic cleft. GABA molecules bind to the GABA receptor, allowing chloride ions to flow into the cell and reduce excitability. In everyday life, this process is of great importance, as otherwise stimulus overload would occur, which can result in psychosis. When benzodiazepines bind to the GABA receptor, the associated chloride channel is widened, allowing more chloride ions than usual to enter the cell, thus limiting the excitability of the cell to a greater extent, resulting in the sensation of sedation, anxiety relief and drowsiness. The short duration of action of benzodiazepines is the dangerous thing and can be highly addictive. After 4 weeks of continuous use, a strong physical and psychological addiction is said to set in, with withdrawal symptoms of which are exactly those against which the drugs were actually used. 2/3 of all patients who are prescribed benzodiazepines are over 65. What is administered as a tranquilizer can cause restlessness, confusion, uncontrolled movements, loss of consciousness and depression, with relatives and doctors then not knowing whether the symptoms are natural or whether they are side effects. In the USA, more than 20% of people take benzodiazepines in a year. It is also said that more than 20 million people suffer from benzodiazepine addiction, most of whom are not even aware of it. For the companies, however, benzodiazepines are a lucrative business worth billions. The annual growth rate of the benzodiazepine market of 2.4% does not indicate a decline. Asia Pacific has been growing fastest since 2021. Benzodiazepines are in the group OT, the most commonly abused drugs in the USA. To avoid developing an addiction, use should always be discontinued while slowly reducing the dose. A tolerance can develop as early as 2 weeks and increases rapidly with duration of use. All benzodiazepines have a wide therapeutic range without which medicine as we know it today would not exist. Diazepam, lorazepam and midazolam are included in the World Health Organization's list of essential medicines. Apart from being highly addictive, benzodiazepines are very safe drugs when they are used correctly.